Okay, so if you're expecting a baby, the idea of a C-section can feel, well, a little scary, right? It's filled with so many unknowns. But what if we could flip that script? What if we could turn that anxiety into confidence? Well, that's exactly what we're going to do today. We're going to pull back the curtain on the operating room and show you how it all works so you can feel empowered, not afraid. All right, let's get into it.
And this quote from Dr. Prashanth G really hits the nail on the head. He says, "The fear of a C-section often comes from the unknown. Once you understand, the OT stops being a scary place and starts being a center of safety." And isn't that the truth? With all the bright lights, the constant beeping, everyone in masks, it can feel really clinical and not at all like what you imagined for your birth plan. But that's what we're going to change. We'll show you how all of that is actually part of this amazing, well-rehearsed dance, a choreography of care, all for one single reason: to bring your baby into the world safely.
All right, first up, a center of safety, why the OT feels different. So let's start by totally reframing how we think about the operating theater. Forget what you've seen in the movies. We're going to look at it as this incredible zero-error zone where literally every single detail is there to keep you and your baby safe. So let's break down what you'll actually experience. You walk in and boom, it feels cold, right? That cool air, usually around 18 to 22 degrees Celsius, is actually on purpose. It seriously cuts down on bacteria growth and keeps all that high-tech equipment from overheating. And all that constant beeping you hear, it might sound alarming, but it's really the opposite. It's the sound of your team watching over you, monitoring your vitals in real time. Then there's the blue drapes and all that steel. Think of it as your personal safety shield, creating this sterile bubble to keep any and all infections out. See, nothing is by chance. It's all about keeping you safe. Okay, next up, we have the path to your baby, a choreographed procedure. Now we're getting into the surgery itself. And a C-section isn't just a simple cut. It's more like a really precise, really gentle journey through different layers, and you've got this whole expert team guiding the way. So the whole thing kicks off with what we call the golden shield. That's basically this antiseptic wash that gets your skin ready and creates that super clean area. Then comes the bikini cut. You've probably heard of it. It's that low horizontal incision. After that, the team carefully makes its way through the strength layers, the tough tissues that give your core its strength. It's all about clearing a safe path to get to your baby. Okay, stop for a second because this next part is huge, and it's a major worry for so many people. We need to be super clear. Your abdominal muscles are not cut. Seriously. What the surgeon does is gently separate them right down the middle, kind of like opening a curtain. And then once your baby is out, they just fall right back into place. This is probably one of the most important things to know because it's a total game changer for a faster, easier recovery. All right, let's talk about the tugging moment. Right as your baby is about to make their grand entrance, you're going to feel this heavy pressure, like a pulling or a tugging. And I know that sounds weird, but it's actually fantastic news. It's proof that your anesthetic is working exactly as it should. See, it blocks the nerves for pain, but not the ones for pressure. So when you feel that tugging, you can smile and know, okay, this is what's supposed to happen. It's working. Now, get ready for this because this number blows almost everyone's mind. From the moment the surgeon makes the first incision to the moment you hear your baby cry for the very first time, how long do you think that takes? Just 5 to 10 minutes. That's it. It's so incredibly fast, and it just shows you how skilled and in sync the entire team is. It's truly amazing to watch. And then you hear it, that first cry. It's just the best sound in the world. Now we move into the first hello, birth and beyond. Because right after that amazing moment, the team's choreography keeps going, and the next few minutes are all about your baby. So something really cool that happens now is a practice called delayed cord clamping. As long as your baby is looking great, the team will actually wait about 30 to 60 seconds before they clamp the umbilical cord. This isn't just waiting around. It's a modern, super important step that gives your newborn a huge natural health boost. And in that short little pause, your baby gets an extra 80 to 100 milliliters of amazing iron-rich blood from the placenta. To put that in perspective, it's like a shot glass full of liquid gold. This is so important because it builds up their iron stores, which helps with brain development and can prevent anemia for the first 6 months of their life. It's a perfect example of science helping nature do its thing. Okay, so your baby's here, you've probably had that first amazing hello, and now the team's attention shifts completely back to you. This brings us to our next section, precision and care, the closing procedure.
because getting you closed up safely and beautifully is just as important as the delivery itself.
And check out this contrast. Remember how the delivery only took like 5 to 10 minutes? Well, closing everything back up takes about 30 to 45 minutes. Way longer. And that's a good thing. This part is definitely not a race. The team is being incredibly meticulous, taking their time to line up every single layer perfectly so you can heal as well as possible. So how do they do it? Well, your uterus is closed up with these amazing, high-quality stitches that just dissolve on their own, so you don't have to worry about getting them taken out later. Then for your skin, they'll use different methods, maybe tiny stitches hidden under the surface, or staples, or even a special surgical glue. But the goal is always the same, to create a strong, clean closure that heals into a scar as thin as a pencil line. All right, this next part is all about you, because I really want you to hear this. You are not just a passenger lying on a table. No way. You are a key player on the team. So let's talk about your role on the team and how you can actively participate. So here are a few simple things you can do. First, the hands down rule. It's super simple, but so important. Just keep your hands down by your side, away from all that sterile blue stuff. It helps keep that safety shield intact. Second, talk to your team. Your anesthesiologist is right there by your head for a reason. If you feel dizzy or sick to your stomach or anything at all, tell them immediately. They can fix it. And finally, remember your deep breath target. Just focus on taking nice, steady breaths. That breathing is pumping oxygen directly to your baby right up until the moment the cord is clamped. Let's also bust a couple of common myths, because getting these out of your head is part of your job too. Myth number 1, I'll see the surgery. Nope, absolutely not. There's a sterile screen right across your chest. That's a complete visual block. You won't see a thing. And myth number 2, the tugging means the anesthesia is failing. We talked about this, but let's say it again. It means the exact opposite. It's the best sign that your block is working perfectly. And speaking of communication, here are a few specific things you should definitely speak up about right away. If you start shivering uncontrollably, tell them. If you feel like it's a little hard to breathe, tell them. If you suddenly feel really nauseous, tell them. Now listen, none of these are emergencies. They are super common, totally normal reactions. The team is expecting them and they have solutions ready to go, like a warming blanket or a quick tweak to your meds. Your voice is the key to your own comfort. I really want this final idea to sink in. This quote says it all. The OT is not where nature ends, it's where science steps in to ensure nature's goal is met. You are the VIP of the room. A C-section isn't a failure or a detour, it's science and nature working together. And in that room, never forget that you are the absolute center of it all. Everything and everyone is there for you. You are the VIP. So by knowing the why behind every beep, every feeling, and every person in that room, the unknown suddenly becomes, well, known. It's not scary anymore. It's a partnership. You know the moves, you know the rhythm. So now that you know the choreography, the only question left is, are you ready to be the star of the show?